Just check me.
Live, Brother Ravi.
Okay.
If you can check on your ends for the MAI page as well. I'll monitor the CAIR-Philadelphia page.
Yes, we are live on Facebook now. Did you have any questions? Well, we're gonna get started. Thank you all for joining the Muslim Aid Initiative and CAIR-Philadelphia Healthcare webinar and Back to School. As we discussed the current phase of COVID-19 and back to school topic with healthcare professional and school board director as well as government official. Today, I am co-hosting this event with my colleague, Dr. and back to school topic with healthcare professional and school board director as well as. Before we get started, I'd like to read out this disclaimer. The advice in this program does not constitute doctor-patient relationship. The program intends to increase public awareness. With that, I would like everyone on the panelists to introduce themselves. And before that, I would like to start with my co-host, Dr. Ahmed.
Thank you so much, Dr. Rabiul, and thank you so much to everyone who's joining us here on Zoom and on Facebook. We are grateful to our wonderful speakers, and we are grateful to Brother Rabiul and Muslim Aid Initiative for bringing this wonderful team together. I just wanted to remind our audience on Zoom and on Facebook to please feel free to post your questions in the Q&A or the chat portion so that we can direct them to our speakers.
Thank you, Dr. Ahmed. Dr. Najmun, could you introduce yourself?
Yeah, sure. My name is Najmun Riaz, and I'm an adult psychiatrist by profession. I do want to share I was raised in Kashmir, which is a conflict-ridden area, and having a first-hand experience of going through months to years of lockdown, curfews, and battle between Indian military forces and the revolutionaries in Kashmir. I have directly witnessed huge lapses in my own personal academic areas. My generation has gone through a long shutdown of schools and colleges, that too in an era of absolutely no internet, no cell phones, no computers, and not even any form of educational material on the TV or the radio. But here I am in front of you, a psychiatrist, a physician, a mother of 3 children. I'm also a school run for one of the school councils in my local children's school area. I do practice psychiatry in Jefferson at Cherry Hill. My kind of population is very diverse and varied, ranging from a high socioeconomic status to a very low socioeconomic status. I see patients from all ethnic backgrounds, different faiths, and from different races, struggling from severe mental illness to a mild mental illness, addiction, and mostly trauma-based clients. I do thank CAIR for giving me this opportunity where I can share with my fellow humans about some of the anxieties that we're going through, and the fact that we're all in this together. Being anxious during this time is a very normal human response. So I will try my best to answer some of the questions. And my hope at the end of this webinar is that we may not solve all the problems, but at least we can know what are the more appropriate questions to ask our schools, our doctors, pediatricians, school counselors, and just some support for parents in general. So thank you for this.
Thank you, Dr. Najmun. Senator Tim?
Thank you. I'm Senator Tim Carney. I represent the 26th District Senate district in the state of Pennsylvania, the Commonwealth, which includes parts of Delaware County, including Upper Darby and environs. I also have parts of Chester County as well. It's my pleasure to be here with you today. This has been unlike anything that any of us have ever experienced, the COVID crisis that we're going through. And it's a moving target. So it's good that people are reaching out and trying to get information from good sources. So I hope today we'll be able to answer some questions, and we'll be able to give you an update on where things stand from the government point of view. I live in Swarthmore, Pennsylvania, and been a resident of Delaware County for the last 25 years. I am an adjunct professor of architecture at Drexel University, practicing architect as well as a state senator, although I'm not practicing very much these days. But it's my pleasure to be here.
Thank you, Senator Tim. Dr. Kelly.
Yeah, John Kelly. I'm a professor of orthopedic surgery, University of Pennsylvania, and director of shoulder sports medicine. And I hope to bring to the table the sports medicine doctor's perspective, dealing with athletes on a daily basis. It's my charge to take care of the safety and well-being of our athletes, and a big proponent of the sports and engagement in sports, but it has to be done on a safe level. So as a sidebar, I know Rabiol very well, and I'm just delighted to be his friend because he spends so much time helping other people. And I'm very sensitive to Islamic causes. My mother was born in the Middle East. So even though I'm Kelly, I have Middle Eastern blood. So I'm just very grateful to be here.
Thank you, Dr. Kelly. And I spent a lot of time at Whitman Hall. Ed?
Thank you. I'm Ed Brown. I wear multiple hats in the community. I'm part of the Delaware County Black Caucus. I am a proud member of a nonprofit called Men of Action Brothers of Faith that does a lot of community-based activities. I'm also the president of the Upper Darby School Board. And in my daily capacity, I'm a senior systems, I'm a cybersecurity engineering manager for Lockheed Martin. So I do a number of things. I've been a resident of Delaware County and Upper Darby specifically for the last 25 years. And, you know, just very active in my children's life. I have 2 sons in college and a daughter in middle school. So thank you, Rabul, for this invitation. And I'm honored to be a part of this distinguished panel. Thank you.
Thank you, Ed. Dr. Arshad?
Thank you, Rabiul. Assalamu alaikum. It is such a pleasure being here again. As an introduction, I am an associate professor of medicine at the University of Pennsylvania Health System. My background is pulmonary critical care and sleep medicine. So because of that, I had a lot of exposure to the COVID patients that we had in March, April, and May, and learned a lot from that. It was a great time, and we still continue to evolve from that experience. And I do also want to say what I am from the same medical school as Dr. Najmun Riaz, and I totally feel her emotions about this lockdown. When our kids went through lockdown, we were really, really prepared to tell them to kind of guide them or navigate through them through this without developing too much anxiety, because we had gone through it ourselves for months and years during our education. And because of that, I would add that we had to do an extra year of school because we missed 1 year of medical school education. So glad to be here again, and learning from our past experiences, and hopefully we forge ahead as a community and learn from our past, and and handle the future very safely and very well, and especially in this crisis.
Thank you very much. And once again, thank you all for joining us today. And this webinar it's been hosted in multiple platforms. I just wanted to name them really quick. Muslim Aid Initiative page, as well as CAIR-Philadelphia, Masjid Al Jamia, ITV USA, FM 786. With that, we're going to start our webinar, and we're gonna ask Dr. Arshad to kind of give us an overview of what's going on.
Thanks, Rabiul. Yeah, I'll start with this next slide. Just wanted to give the audience here a quick recap of what we're dealing with, what COVID is, and where we are right now, without going into too much detail. So, one of the most important things to remember, it has been told over and over again, is the reason that there's been such huge pandemic is because the infectivity rate of COVID. So, if one person is infected with COVID, that person can infect up to, you can see in that slide, up to 4.5, 1.5 to 4.5 other individuals as you get close to them. So that's what's leading to this, surge of this disease, and you see in different communities all over the country and elsewhere in the world. And keeping that in mind, and you can see the seasonal flu is in the bottom. It's not that infective as this COVID-19. So we have to be very careful when we hear about social distancing, mask. This is just to decrease the infection rate so that other people don't get infected. Next slide. Also want to go over some of the data as of now. This is from yesterday. This is from the Johns Hopkins Coronavirus Resource Center. And you can see United States of America is all red. I think it's just that the map by itself speaks that where we are and how long we have come and what kind of challenges we have in front of us. And you can see particularly our area in the Northeast is completely red compared to other countries in South America, Europe, and Asia. Next slide. And this is the global cases. You see daily on CNN, other news channels, but to just understand the magnitude, since with testing so far, 22 million, almost 23 million people are diagnosed with COVID, and this is with limited testing capabilities. And we lead all the countries in the world with 25% of the global cases, right here in the US. And we followed very closely on our footsteps with Brazil, India, and then Russia. And then in terms of global deaths, we again lead the world with 22% of the global deaths. I mean, this is again showing you that we are up ahead of the curve, and there's a lot more that we have to do as a community. Next slide. And this is comparing the states, the top US states in terms of cases on the left side in the red color. You can see New York State, obviously, because it had a huge, it was an epicenter, it was a huge surge. At that time, New York leads all the states, followed by California and then Florida. And I can tell you there's Texas right behind. And then we can see that Philadelphia, our area, thankfully, learning from our swine flu experience in the early 1910s, we probably learned our lesson, and we are at number 22. So that's I think it's typo. There's actually Pennsylvania, which is number 22 among the states in the U.S. And then in terms of deaths, New York leads, followed closely by New Jersey, our neighboring state, and then again Pennsylvania is number 8. So we are up there in terms of death rates. And I'll tell you the theory behind this is because of the social, economic, racial disparities in our area. Next slide. This is a kind of daily new cases that are reported every day in terms of where every state is, in terms of how they're doing with their new cases. And I'll go into the neighboring states that we have. Rabiul, can you go to next? So this is New Jersey. Surged in March. In April, we reached a peak, and then has been coming down steadily. As you can see, both these states have strong governors, and the political system, whether it was Republican or Democrats, everyone kind of helped together and kind of face the situation. And we have good results in New Jersey, and you can see that the new cases has kind of been steady since June, July, and August. But next, you go next to Pennsylvania. Well, you can see in Pennsylvania, we have challenges. We hit the peak in April. We went down, we got better by the end of June. And then since again, from July early, we're starting to see more peaks, which is again leveling off in August. But that's been a challenge in Pennsylvania state compared to New Jersey. We go to the next slide. So here is the Pennsylvania COVID dashboard for Pennsylvania state. And you can see Philadelphia County, and then next to it, Montgomery County, and just south of it, Delaware County, all red. So you're seeing that this is like high infectivity rates, high number of cases per unit population. And if you go to the next slide, Now, comparing the Philadelphia County with the Delaware County, you can see the number of cases infected in Philadelphia is 28,000, while as 10,000 in Delaware. But the number of deaths in Philadelphia is about 1,700, while Delaware is 700. But you can see in Delaware also in the red graph, the infectivity rates, the cases are going up, settling down a little bit, but we might be seeing another surge soon if we are not careful. Next slide. And this is demographics. This is very important. Only some states, probably 37 states, report demographics on COVID cases and mortality. And we're lucky that Pennsylvania has. You can see most of the patients who are infected are women. And then you can see non-Hispanics. But there's a huge chunk of people who do not reveal their race or identity, ethnic background. So that's the brick color, the red graph, which is a lot of people. But you can see in terms of age, you know how we always say that young people are not affected by COVID. Maybe they do not have high mortality. They do not die because of COVID because they're young, they're healthy, but they are infected very easily with COVID. Only I think the patients who are less than, or kids who are less than 10 years old have a low risk of getting infected, but everyone else, teenagers, young adults, everyone, you can see in that graph on the right upper corner, it's equally spread across those age groups. And then you can see also again in the lower graph, then African Americans are more affected than any other ethnic group. Next slide. And then with the deaths, you can see again, women are more in a high risk of death in women. And then in terms of death, again, in terms of age, it's usually the older people with comorbidities, like diabetes or heart disease, lung disease, who will die. Young people usually will survive COVID, although they may be infected as easily as older people, but they do survive this disease. And again, African Americans are more affected by this disease. The mortality is higher in that population than in the white American population, for a comparison. Next slide. Now, these are the risk factors for COVID. So this is for our audience. You know, how do you know if you get COVID, what are your chances of getting into a hospital and getting sicker? Those are the risks. You can see the circles. The bigger the circle, the more the chance. You can see on the lower end is asthma, then your hypertension, obesity, diabetes, chronic kidney disease. If you have more than 2 conditions, more than 3 conditions, then the risk obviously goes higher and higher. Next slide. This is important to look at the demographics. And if you look at the cases, hospitalization and death, you can see that in African Americans is the highest. So in African Americans, 2.6% higher chance of infection, 4 to 5% higher chance of hospitalization, and 2 times higher chance of death. And so also in the other communities like Asians, Hispanics, and Native Americans. Next slide. And this because we're talking about COVID and going back to school. So this is just to kind of let our audience know, if we are young people in the audience or parents, that it does affect everyone. You know, the hospitalization and death is higher in patients who are older because of comorbidities. But if you look at the comparison group of those people who are young adults, they get this infection as easily as other adults. But obviously, the risk is lower in kids who are less than 10 years old, but it's still there. So it's important to remember that you have to prevent yourself from contracting or spreading this infection. And the next slide. I think this is the staggering impact of global education. You know, we're not alone. If you see, since this pandemic has started, schools have closed all over the world. There are about 1.38 billion kids who were impacted by school closures worldwide. And this is by the end of March. And, you know, we might see that again in some form or other, though the schools are going to hybrid programs, but you might have to retract and go back to online learning again, and vice versa. So those challenges still remain there. And I'll go to my last slide. So these are the projected US deaths. We are at almost 200,000 deaths, but the projected deaths from the Institute of Health Metrics and Education, which is maintained by University of Washington, they do a phenomenal job. And this is what we have been following since the beginning of the epidemic. You can see there's projected deaths of 309,000 Americans by December 1st. And you can see those 3 dotted lines at the end. That shows what can happen if we do not use masks. Then our death is going to go up. if we are observing, social distancing, using masks, then we can bend this curve downwards. Next slide. And same in New Jersey State versus PA State. In New Jersey, we reached the peak deaths, I think, end of April, May, and New Jersey staying steady. The deaths are not expected to go higher in New Jersey State, but Pennsylvania State did well in the beginning, but it's projected to have higher deaths by the end of December, up to 15,000, which is alarming. I think that's where we need to bend that curve down to resemble the curve that's been seen in our neighboring state of New Jersey. And the next slide. So, I think the aim is basically to encourage people to not become complacent, because we're doing better doesn't mean that this pandemic is over. We need to keep maintaining those good practices that we learned: hand hygiene, mask, social distancing, protecting our families, and continue doing that till we know for sure that this disease has been completely controlled and disappeared. That will be only after the vaccine is here. Thank you.
Thanks, Dr. Arshad, for the wonderful presentation and explaining to us the current situation of COVID. With that, we're gonna go into some of the questionnaire we have. First, we're gonna go to Senator Tim. So, Senator, like you said, you represent few districts in Delco as well as Chester. In Delaware County, we do not have a healthcare team, and we have seen spikes in Delco initially more than other counties. Could you please shed some light on that, as well as if you could comment on the upcoming stimulus check and the ongoing debate that we hear?
My pleasure. So in Delaware County, we have never had a health department. It's never been a part of the county government. It was a decision that various leaders over the years have made not to have. We are the largest county, the most populous county in the Commonwealth that does not have a health department. This was problematic at the beginning of the crisis, because we had to rely on the state health department for everything, and the state health department, it was dealing with the majority of the state. There's actually only about 6 or 7 counties that have their own health departments, but those counties were much more nimble and able to get information out and to deal with situations as they came forward. We are lucky because Chester County, which is right next door to us, basically we went to them and they decided they had the capacity to handle our response as well. So our de facto health department for this particular crisis is the Chester County Health Department. And I think they've done a pretty amazing job at dealing with both counties and getting us collecting and getting information to us in the ways that we need, in the ways that make sense. So I will say that the new government that was elected this past year in Delaware County, one of their prime goals was to establish a health department. And there was just a public Zoom meeting on that the other day, where they laid out their plan to basically have the health department up and running by the end of next year. It's a complicated endeavor. There's a lot of moving parts to it, but that is actually working. So in terms of what we've actually seen in Delaware County, in the month of June, for example, we were at about a little over 700, I think 720 new cases reported in that particular month. And going into July, it more than doubled. We were up over 1,400 cases that got reported in July. So obviously moving in the wrong direction, not the way we would want to see it. A lot of these events and these spikes in the numbers of cases seem to revolve around holidays. July 4th holiday was a big one, where we had a lot of Pennsylvania residents who were down at the Jersey Shore, for example, or other places, and came back, didn't necessarily do the proper social distancing, or probably weren't wearing masks and things like that. And we're still learning, and I know the doctors can talk about this, but we're still learning about the way that the virus is spread. and who's susceptible. It seems like every day, I know it's confusing because it seems like every day there's another newspaper article that has a different spin on it or a different way of how these things work. Did that pretty much cover it?
Yes, I asked you about the stimulus check as well. We
The
recently,
stimulus check.
yes.
Well, the stimulus check, as you know, the additional $600, which came directly from the federal government, was stopped about 2 or 3 weeks ago, and they're still arguing it over it in the nation's capital in Washington. I know that the governor basically signed on for what was being offered through an executive directive from the president, which was a $300 check. So we're in the process of following through on that with the hope that the Senate will pass the HEROES Act and we'll actually get it back to the $600 additional money.
That would be wonderful. Thank you.
Sure.
Wonderful. Thank you, Senator. So our next question is for Dr. Kelly. Dr. Kelly, so what does post-surgical care look like after the onset of COVID-19? The question is, how often should patients expect in-person physical therapy compared to virtual care? We know that you deal with student athletes. What are you hearing from athletes or student athletes? And of course, Rabiul also asked me and told me that you are quite the stand-up comedian. So what would you say about healing through the humor? Do you employ that in this time?
Well, thank you. I don't know if he wants to open that can of worms because I could go on forever with comedy, but I think that healing, humor is the best medicine, and it has to be appropriate humor, has to be affirming. And, I'll often brighten up if someone's nervous before surgery. I just make a little comment if I can. You have to read the room, see if someone's receptive to it. And if you have bad news, you obviously don't want to joke about that, but a lot of people are very nervous when they see a surgeon. So I try to break the ice. And, I tell them things like I just got my license back, or, I just made parole, just little things like that. But anyway, none of which are true. So, the physical therapy question is a good one. It's a moving target, and it's very center-based. We at Good Shepherd Penn Partners, our chief therapy vehicle, they are seeing inpatient evaluations now, but our health system is very careful. Everyone who comes in our building has a temperature check. And I have to make a disclaimer. I'm an orthopedic surgeon, but not a real doctor. We have some other real doctors on the call, and they can comment up with further. But I do think that, our surgeries are only done on people that are COVID negative within 72 hours. We have to have a test. So people that are worried about getting surgery, I tell my friends it's probably safer to go to the grocery store than go to our hospital, because all our patients get tested, and no staff is allowed in the building with a temperature. So we all get infrared temperatures walking in the building. So those are good things. Obviously not 100% successful, because as the other doctors on the phone know, that you can actually be asymptomatic and transmit the disease. But I'm happy to say that I can't think of a single patient who's developed COVID post-operatively. So, and just to finish up on the therapy piece, we've been hybridizing our medicine, and that's why we need people that are very technically proficient like Rabiul, because I've become much more proficient in Zoom. Even though I couldn't get on my computer tonight, I'm on my phone, I can figure some things out. But I've actually enjoyed the Zoom encounters with patients, because many of my patients travel great distances, and they're so happy they can just log in the computer and talk to me. Now, I will tell you, the physical examination, I'm sure the other doctors on the phone would agree with this, remains the mainstay of my diagnostic criteria. So for initial visits, I really do whatever I can to try to get the patient in. And if there's a surgery in question, I will not book a surgery virtual. I insist on seeing the patient so that my examination will confirm the finding. So but I do think the Zoom follow-ups have been very, very good, and I'm getting quite used to them. So most therapists that I work with hybridize their approach. They see some patients, particularly initial evaluation, maybe in person, and the follow-ups are done virtually. And most of our patients are very happy with that. So I wish I was more techno sufficient. I did prepare a PowerPoint. I don't know how to get it to you guys, but I just want to make one comment before I forget. with my, and then maybe Rabio can give me like 10 minutes of mic time at the end. Does that sound good, Rabio?
Sure.
Okay, it'll lighten up the crowd.
One second.
But as a sports doctor, you know, we always look, and I have such reverence for Rabio because he's such a man of God, but we always try to do the right thing. What's the common good? It's like driving a car. We know when we get in a car, you're going to have a risk of accidents. I think that if we can make sports safer, and particularly for younger athletes, and if we are very careful, the discipline, the cardiopulmonary respiratory, the friendships, the character building, I'm very interested in trying to make this work. And if it's going to be, a failure, by God, we're going to, tank it. But I do think that some of the younger athletes and some of the other real doctors in the know that the infection rate for younger, particularly people less than 12, is quite low. But I, as a former athlete myself, what I learned from sports, the friendships I made, the discipline that was forged, and the character building, I'm really hopeful we can make this work for our athletes. I understand today, and I'm sure that the representative can comment on this, the PIA, the Philadelphia Interscholastic Association, released a statement that Philadelphia sports are a go. They're a go this fall. Not so sure I'm totally comfortable with that, but let's just do our very best to keep our athletes safe. And I think that very, very important vigilance is required. Some schools, look what happened, or some programs, the Phillies, that one outbreak with the Marlins, a disaster. So you realize, constant vigilance is important here. But I do think we're getting closer to safely allowing sports to happen. I really do believe that.
Thank you. Thank you so much, Dr. Kelly, for that. And we'll look to that segment. We'll look forward to it. So our next question in line will be initially to Mr. Ed Brown from the Upper Darby School District. So Mr. Brown, if you could walk us a little bit through the deliberations at Upper Darby School District, what you heard from educators, from medical officials, and where things currently stand. And what would you say to parents who understandably would be afraid that their children will not, perhaps may not receive a complete education virtually? Are there considerations around children missing out on developmental milestones? We'll ask our doctors, Dr. Arshad and Dr. Kelly, to comment on that as well. And how do you communicate to parents who are concerned about sending their kids to schools during the pandemic?
Yep, thank you for that question. So I think we all agree that there is no substitute for in-class instruction, and that was the goal. And unlike a lot of districts, our initial plan was to send, was to attempt to keep kids safe, and do give parents that option to have kids in classrooms. But we have to pay attention to what's going on in the country and the township and the state, and listen to the governor and listen to people like Senator Tim Kearney and follow the guidelines that they set up, because they are in tune with the medical professionals, and that's, safety is paramount. So, education is important, but safety first. We want to keep people alive and keep them safe. So that's the main thing. And with that said, we did go back and forth and deliberate, and our superintendent, Dr. Dan McGarry, did an excellent job of crafting what I thought was a safe hybrid plan, where parents had the options to choose if they wanted to send their kids to school to have in-class instruction, and we would practice social distancing. They would be required to wear a mask. The teachers had input on that, but in the end, we did decide to start all virtual for the first couple of months of school, and then we'll reevaluate, because as you know, COVID is an ever-changing phenomenon, and it goes up and it goes down, and we want to pay attention to what's going on and keep safety first, and then do the best we can. We feel like we are good at drafting education plans, and we have a very robust, virtual education system called Schoology. We've given out over 3,000 laptops, and we are in a position to go one-to-one with hardware, where from K to 12, we can provide a laptop to every one of our almost 14,000 students, should they need one. So we feel like we're in a position to provide the very best education we can. And we were proactive even before COVID hit. A lot of the things that we offered were virtual as far as preparing our backbone and our infrastructure and doing staff development with our teachers. And we certainly, increased the staff development with our teachers in light of the possibility of going all virtual, which we are. So we place great emphasis on that. The teachers have been receptive to that. So, we feel like we're well positioned to provide the very best education we can in a virtual environment. We recognize that it does provide challenges for parents that work. And if kids are home and if you have younger kids, you can't just put them in front of a laptop and leave them home alone and expect the right things to happen. There's, logistics involved with that. And we recognize that. And we're working with families. Families have reached out to us, and we continue to ask them to do that. Reach out to the district and talk about the support that you need, because every family has different challenges, unique challenges, and we'd like to do our very best to meet them where they are. So I hope I answered your questions. Thank you.
If I could interject, Mr. Brown, I just want to thank you for what you're doing. And, the public has this perception, and it hits home to me. My daughter's in education, my uncle's education, that teachers just don't want to work. And that's the furthest thing from the truth.
Correct.
I want the public to know that the teachers that I know, they want to go back, and that virtual learning, the public is harder than being in the classroom.
It is.
And
it is.
There's this perception, and the media is part of this, like, oh, teachers, they just want to, lock jam and they don't want to go back to work. The furthest thing from the truth. Isn't that right, Mr. Brown?
I absolutely agree, Dr. Kelly, and I'm glad you brought that out. Our teachers want to be in front of their students. They recognize the challenge of teaching virtually because, engagement is personal. True learning is personal, and eye-to-eye contact and physical contact, and being in a classroom with a student, especially younger students, you need to be there, and students connect with their teacher and engage. It's just not the same virtually. We'll do it the best we can with the hand we're dealt, but I do agree with you, and our teachers we're excited about the options that we gave parents as far as being able to provide an in-class instruction, but we're not going to put people in harm's way. Our teachers have families and they have children, so virtually is harder. It does provide challenges because if their kids are home, then they have to have provisions for their own children and also teach at the same time. So there's a lot of challenges and a lot of logistics involved. But thank you for pointing that out, Doctor. You're absolutely right.
You're welcome. Thank you.
I would like to make a comment on that. I think when the hospitals got hit with COVID, we're organized places, and we face so many challenges that I think the teachers are also going to face now, and schools are going to face. And we really, if you look at New York and these places which were hit with, which were like the epicenters of epidemics, it was chaos, right? And people lost lives. So I feel personally, I second both of you, Dr. Kelly, you mentioned that teachers and schools going back, they haven't been to work since this COVID started. They were at home, and they're going now and facing this challenge. And it's amazing that they have done a fantastic job planning for this. We get to emails and messages and very important updates from schools all the time, every thrice a week, just planning for this and, trying to protect the health of our kids. I think it's a challenge, and I think we need to encourage our schools and really appreciate all the work they are doing. It's going to be difficult because these kids have not yet faced this on a scale like we have faced as adults or in the healthcare system. But one of the things I feel is that it all starts with being a role model at home. It depends on what you're talking at the dinner table. If you are, enforcing and kind of encouraging your kids to understand what COVID is about and how to protect them, so that wearing a mask is important, social distancing is important, not gathering, more than 10, 15 people having a party is important, then they will kind of follow that kind of model behavior in schools also. So that's what I think. And the challenges with the college is going to be even higher because now they're living together in dorms, shared bathrooms, dining halls, laundry. So, you have to be really, very cautious about, educating your kids about being safe, and also safety for the staff in the schools.
Mm-hmm. Mm-hmm.
Absolutely.
Thank you, Dr. Rashad. And I was going to ask you to comment on parents who might live in districts that have an in-person option for both parents working. And I think those tips will be very helpful for those families. And just quickly moving over to Dr. Najmun for another aspect of this, in addition to the physical anxieties, there's the mental aspect. So school and college experience will be different, remote learning, different cohorting, social distancing, and there are different sets and rules. There is the pressure of learning, trying to learn online. So all of this combined, Dr. Najmun, if you could walk us through the anxiety that this might spark, and how can both students, parents, and also school workers, teachers, and others can address the mental and social well-being at this time?
Emma, thank you for this question. And this is something that I hate to sugarcoat. I'm a positive person. I usually, reassure my patients and, spread out positivity. But this is something that I would hate to sugarcoat because this is a genuine problem. This is a problem which has never happened before and probably will hopefully never happen again. We're in the middle of a pandemic. Besides the safety and the physical aspect of this illness, there is a huge emotional, mental, and a social burden. And unfortunately, the biggest victims of this aspect are our children, our teens, our college goers, besides, of course, the other people in other areas. I do want to bring this point before I can move on to the question. Is, like how in a family, if you have any calamity, any major stress, the children look up to their parents. They see the mood of their parents. They see the level of the anxiety of the parents, and they also see the level of the partnership between the parents. Meaning, if the mom and dad are on the same page, they're able to handle this stress in a more effective and a positive and in a very human way. The children feel less anxious. They feel secure. They feel safe. I think a similar model comes to this country and this world as in general. If you have leaders who give an inconsistent message to the population, to the communities, the level of anxiety is going to be way high. And I don't want to hit the political aspect of this, but I, on a personal note, as a mother, as a human being, and as a physician, do feel that our nation, unfortunately, is going through extremes of anxiety. And yes, the pandemic caused it, but I think the inconsistencies in the leadership has further elaborated this anxiety. So at this time, it shouldn't have been like this, but it has come to a very, very individual level. The safety of our children, the safety of our families has come to an individual level. And fortunately, again, I am so happy to see how communities at an individual level have pulled this out together. As compared to what happened in March, look at where we are now. We have managed the most difficult part. I have been amazed to look at these healthcare workers on the front lines, the nurses, the respiratory techs, you name it. How have they come from this mode of uncertainty, having no idea of what to expect, to a point where now, look at them. They are secure. They can handle the patients. They have gathered so much of information about this virus, and they are much better prepared. I'm amazed at the level of resilience that they have shown, level of patience, and level of compassion that they have shown. So that said, coming back to your question, Amit, I had to make this point. The same theory or the same practice implores to our families and such, our children and our teens who are struggling right now. So here the responsibility would go on the parents and the school authorities, including the staff and the teachers. Now, what can parents do? I think, first of all, the parents have to be in check of their own anxiety. And they have to tell themselves that if they are anxious, if they are worried, if they are confused, it's okay. It's very normal to feel what they're feeling. I, as a mother, in spite of me being a mental health profession, I feel anxiety. I go back and forth between should I send my kids to school or should I just keep them home? So I just want to tell the folks out there, the parents out there, that it's okay of what you are going through. So first of all, acknowledge your feelings. Secondly, acknowledge your child's feelings and emotions. Check with him often, frequently, see where they are at in terms of going back to school. Ask them questions like, how do you feel about going back to school? Would you like to stay home or would you like to go in? Are you missing your friends? What are your concerns? What are your challenges that you think you're going to face? So, stating that, um, base your decisions not on your fears and not on what you hear in the media, the news, and the politicians, but based on facts and science. Google up articles, begin with your child's pediatrician. Talk to them about, what to expect, what can we do. If you notice in your child the level of stress is affecting their day-to-day performance, meaning if you notice that my child is having behavioral issues, he is becoming more angry, more irritable, it's affecting his sleep, all of a sudden he stops eating, he's becoming very clingy. So that tells you that your child is under enormous stress. Under that situation, please do not wait, do not hesitate, go seek help. There is online counseling, there are counselors that your pediatricians can refer you to. There's a lot of big referral base out there that you can gather that information and have your child go seek that help. But before you have your child seek the help, monitor your own emotions. And if you think you yourselves as parents are going through extreme level of anxiety, you can't sleep, you are irritated, you're constantly annoyed by your child who needs you way more than any other time, then please go seek help yourself, whether it's in the form of talking to a friend or talking to a counselor, talking to a physician, then please go and do that. Now, for the teens, I do want to bring this up because our teenagers are the ones who are most affected by this in terms of their social interaction, and their social interaction affects their mental and emotional well-being. Our teens, they depend on their friends. They are less close to their parents at this age than they're with their friendships. And of course, that has declined to a little bit of a level. And I understand that parents out there are concerned about the screen time. They do notice their teens are on the phones all the time. I think this would be a time where I, as a parent, wouldn't worry too much about it. Listen, this is probably the only interaction that your teen has with his world out there. So just a subtle monitoring, and again, set up a structure, set up certain rules, which is sleeping on time, spending a little time with the family. Make up a pact with your child saying that, okay, this is the dinner time for half an hour. There will be no screens on the dinner table. So just those little moments. And again, watch for your child's health in general, meaning like if you notice any major change, like, he lost interest in certain things that he used to love doing before, or he is not taking care of himself anymore, or other such habits, then please go ahead and seek help. There are some online support groups for teens. So if you Google up in the area, or if you even want to just send an email to a school psychologist, they can provide you some resources. So I would highly encourage parents to do that. Then I want to talk a little bit about the responsibility on our school authorities. Of course, besides making sure that the schools are safe, they provide this academic help to the children, I think schools will have way more responsibility this time. So this is just as a request as a mom and as a mental health profession, that if there are schools who feel that they have some budget or some finances which they had reserved for, like maybe extending a building, bringing in more computers, or opening a new gym, this would be a time to avoid doing all of that. This would be a time to utilize all that finances in establishing a more powerful mental health system for the schools, maybe hiring some more school counselors. Again, checking in with families, like you have these little cohorts that the schools have created. So besides checking the academic progress of the children, it's very important to check the emotional and the social performance of the children, where they stand for. If that happens, kindly reach out to their families and just work together as a team as to how we can make this child feel safe, secure, and just feel comfortable in whatever area he chooses to get his education from. So I think those would be some of the things that I want to bring up. And again, there for the teens or even for parents to provide them resources about that. We have helplines. There is a national suicide hotline number. Provide parents with local crisis center numbers that in case they notice that their child may be going through enormous stress or there is any self-harming behaviors that they notice, which are like extremely urgent situation where nobody should wait, but please have that child seek help immediately. And lastly, I do want to say is for all the parents and all the folks out there, this is the time to practice compassion. Just be kind to yourself, be kind to your children, be kind to your neighbors, your communities. This time will not last long. It'll leave. Hopefully by 2021, we're going to have a vaccine. But when we look back, we will see what we did in this time. We can truly emerge stronger as families, as communities, and just a nation as general. So we want to spread that message of hope and reassurance to everyone. Thank you.
Thank you, Dr. Najmun. Next question is for Senator Tim and Ed. Again, as mentioned, we were collecting some questions, and this is one of the questions we have received from Power. Pennsylvania has a fair funding formula to distribute the state education funds to districts according to their needs and population, but it is currently only being used for new appropriation. We also know that schools that serve children of color are disproportionately affected by the inequitable funding of school. How does this inequity shows up, particularly during this pandemic? What can we do about this funding issues for schools in PA?
So, Tim,
go ahead, Ed.
You first.
Ed and I have had this conversation probably, 25 times in the last 2 years.
Correct.
Let me first say, Doctor, you're absolutely right. Kindness is what we need more of these days, and we need people to get control of their short tempers and their uncomfortableness in a way that the hardest thing that we've had overall dealing with this epidemic is trying to tell people that you're actually responsible for your neighbors. You're responsible for the people that you come in contact. That's why we want you to wear a mask, not to protect yourself, is to protect the people that you come in contact with. And that level of kindness is the way that our great society, can actually get through this. So let me pivot on that great society point and point out that Pennsylvania ranks about 48th in inequity in funding their school districts. So if I'm going to oversimplify this, but if you go back, say 30 or 35 years, there was basically a pact made. At that point, the state funded about 50% of every child's education across the Commonwealth. And there was a deal essentially made that said, this is when a lot of consolidations were going on around school districts. Essentially the deal was, you can have local control, but you're not going to get as much money. And you need to, you need to make up the difference in your property taxes, which is why parts of Ed's district have the highest percentage property taxes in the Commonwealth, and Upper Darby residents. And that's we're not talking about wealthy people here. So it's the fundamental unfairness of the fair funding formula is kind of ridiculous at times. We have this fair funding formula, which in and of itself is great, but we also have a hold harmless clause. And the hold harmless clause says that, you know, if we gave you X number of dollars last year, we're going to give you X plus whatever percentage. Doesn't matter what your school population is. Doesn't matter, you know, whether your communities are growing. You're still going to get that. And only new money for education goes through the funding formula. So I don't want to steal Ed's thunder, but last year they would have gotten what, $6 million more if all the money had gone through the fair funding formula from the state. So we have two problems. We have the inequities of the fair funding, of what actually goes into the fair funding formula, and then we have the fact that right now we, as in the Commonwealth, provides for about 32% of every student's education, down from 50%. By comparison, in Delaware, the state pays about 74% of a child's education. So what we need is a change in the way we think about things. I talk to my colleagues all the time about, you know, so how do you define the word fair? You know, how can it be that when we look at the maps of where our severely underfunded school districts are, they tend to be, you know, in the places that have a lot of brown and black students, have a lot of minority students. It's the Upper Darbys and the William Penns of the world. How can it be that my school district where my kids went, Wallingford Swarthmore, is, you know, 3 miles away from Upper Darby, and they're the amount, the way the schools are funded and how much you spend per student is grossly different. So all I can tell you is that trying to deal with that situation is one of the reasons I even ran for the Senate. And it's something that we've been pushing on and pushing, and we're not going to change it until we make some fundamental changes in the way we do things in Harrisburg. And that's going to require people to vote. It's going to require getting leadership out of the hands of the current majority to people who actually really do care about these things and represent people in Upper Darby, in Philadelphia, in Chester, in the places where we have these issues. So I'm going to get myself off my soapbox right now and let Ed chime in.
No, I think you hit all the important points, but I'm just going to go back a little bit further and just talk about what Dr. Riaz mentioned as far as the importance of the social emotional learning that Upper Darby places emphasis on, and trauma-informed care. So I wanted to mention those as a piggyback on what you talked about. We've placed great emphasis on those, and we recognize the importance of it, especially in the COVID age, because everything is magnified. And the question that you read was about the inequities and how has COVID affected those. Everything is magnified because people don't think about things like COVID, since everyone is home. Some kids depend on the breakfast and lunch that we provide to eat. They may not get a meal other than that. So we have to think about that as educators and as a district to make sure we still provide provisions, and we do, for kids to eat. You know, we provide meals several times a week, and then on Wednesdays we provide meals for the rest of the week so that kids have something, and we have it at different schools for them to pick up. So, you know, all those things are important. There's so many different ramifications of COVID, and so many different things are affected, from feeding children into making sure that sometimes they may be dealing with a traumatic situation at home, and the only escape that they got was when they come to school. So if they're not in school, then they're exposed to the trauma that they may be experiencing at home 24 hours a day. And that's troubling, and that's disappointing. But now I'm off my soapbox, and I'll talk about funding a little bit. You know, that's personal to me, and that's why, as Tim stated, that's why he ran for to become a senator, and I'm very happy he is. That's why I ran for school board. You know, that's because I care, and I think funding is an issue. I had 3 kids in the Upper Darby School District. 2 are in college now. I still have a daughter in middle school. So, you know, I care. I have a vested interest, and I want them to get the very best out of life, and I want them to get what they deserve. I don't think they should be less funded than any other child in Pennsylvania. So I'm encouraged that people like Senator Kearney, people like State Representative Mike Zabel and State Representative Margot Davison are in office, and they understand, they get it, they care, and they know the advocacy that needs to take place so that the fair funding is done the right way, where all of the money, 100% of the money, goes through the fair funding, not just the new money, so that we only want our fair share. We don't want a penny more than what we're entitled to. But I think we have the most robust, I'm probably biased, but we have the most robust education program in Upper Darby. And I think if you give us our fair share, we'll do some amazing things. We're doing amazing things in education already. So I can only imagine the heights that our students would attain if we were fairly funded and we didn't have to think of creative ways to provide and administer education. So thank you.
Thank you, Ed and Senator Tim, for your answer. Next question we have is for Arshad, right? We hear about, back to COVID again, we hear about these long-term challenges, right? How is the post-recovery of COVID? Is there any, like, are we looking at some permanent damage being done with people that recover from COVID?
Oh, thanks. Rabil. This is a very interesting question that you asked. I give you just a background that, at Ben, we saw almost like 3,500 patients with COVID. And I can tell you roughly, this is what our data and data from other major centers in the US show, that 1/3 of patients who get admitted to the hospital, we're talking about patients who are sick, not at home recovering, 1/3 of them go to the ICU, they end up in the intensive care unit. And about 50% of those patients roughly will be on ventilators. They're very sick. And of those 50%, only 50% will survive. So the mortality is high in those patients. Now, those survivors, when they go back to the community, when they are, out of the units, going back, they usually will tend to either go home with some home health care, or they will need to be in some kind of like a long-term or short-term facility, like a rehab facility or skilled nursing. Anyways, those patients who go home, you can imagine that they've gone through almost something equivalent to post-traumatic stress disorder, being in the ICUs, on ventilators and sedatives, in coma, with multi-organ system failure. So the first and most important, like Najman mentioned before, is going to be the psychiatric, the mental, emotional well-being of those patients. They will have anxiety, they will have depression, post-traumatic stress disorder. And if you look at the prior data from the SARS outbreak or the other outbreaks in the past, about 15% of patients will have anxiety, 15% depression, and about 30% will have post-traumatic stress disorder. I don't think COVID post-recovery is going to be different. There's a lack of data right now because now people are studying what is the outcome of this. I can tell you in our health system, we have the specialized clinic for post-COVID care. So this is a group of pulmonologists, group of medicine doctors, group of psychiatrists, and also some rehab doctors who are managing the patients going forward. I think the first thing for the patients to do is, honestly, I will tell you here, is that if you have recovered from COVID, donate your plasma. I think that is the first thing you got to do. Next is going to be follow up with your doctors and clinic visits regularly. Do not take it lightly. You may need some strengthening. You may need some nutritional guidance. A lot of people will, develop this, what we call post-intensive care syndrome, which is once they survive the intensive care unit, they are left with long-standing physical disability, and they decline in their cognitive skills. So their mental function suffers, the psychiatric function suffers. They get insomnia. They can't sleep at night. And then there's the physical disability, which is a lot of lung issues, because they've had primarily this COVID affect their lungs. So they have persistent symptoms of shortness of breath, fatigue, chest tightness, chest pain, cardiac symptoms. So those are things that need to be, kind of addressed. So these are the challenges that these patients will face. We're still collecting data. Hopefully, in the next couple of years, we'll be much more wise. But these challenges are real, and we expect them. And we're already seeing a busy post-COVID clinic with patients coming in. For example, I can give an example. I had a patient who had mild COVID, was hospitalized for a few days, went home on just nasal oxygen, 2 liters, was taken off of it, went home completely well. But it has been 2 months since then, and has chronic shortness of breath. So now we're doing the workup on it, and this all started after the COVID. So there is challenges post-COVID in patients.
Thank you, Dr. Rashad. Over to you, Brother Ahmed. I think you're on mute.
Okay, wonderful. Sorry about that. Thank you so much, Dr. Rashad. So we are coming to the last few of our questions, and we'll again remind our audience to post their questions in the different Facebook and Zoom chat sections that they see. The next question is again around COVID and the flu season. How will the flu season that's starting? We are seeing already ads from pharmacies that they are offering flu shots. How will that impact COVID-19 dynamics? How can we educate our college-going students and others who might be going to schools about this in connection to COVID-19? So if Dr. Rashad and Dr. Kelly can quickly address this question.
Yeah, I can. The flu season coming is definitely going to be a big challenge because partly, number one, because the symptoms are the same, right? So in summer, when we had a patient come in with fever, chills, muscle aches, we thought about COVID. We got the testing done, and we go from there. And the flu season coming in is going to be difficult because you won't be able to differentiate whether it's flu or whether it's COVID. And you will have patients who will have coexisting both diseases. Fortunately, we'll have better testing capability so we can rule them out and treat them. So it's very important then that people understand, if they have not had flu shots in the past because they did not believe in it, that they start believing in it now this year, that you take a flu shot so you protect yourself from flu. And then if you develop symptoms, at least you can focus on whether you have COVID and get tested for that. Last year, I think we were fortunate that the flu season was not as bad as been in the past years. But despite that, there's always several thousand people who die because of flu in the US. And that kind of a disease similar in presentation to COVID when people get sick. I think the question is, which many people will ask, is should I take the flu shot now because I think it's going to be available very soon, or should I wait? Because most of the times when you get a flu vaccine, the immunity may wane in 3 to 4 months. So we're basically saying as long as there's no acute surge in COVID in our area, I would say to our audience, maybe wait till the end of September to get your flu shot, because the flu season ends by around middle of March, so that you have good immunity through the winter months when COVID could potentially come back.
Yeah, I'd like to add to that. Again, Dr. Rashad's the specialist, but just as a generalist, as a sports medicine physician, the things I think the families need to know are just general health measures. And I'm sure Dr. Najun knows this too, but you can maintain combinant immunity in several ways, holistic ways. Controlling stress. Make sure your child is dealing with stress properly. Stress whacks your T cells. I mean, it's just studies upon studies. The second thing we often forget is sleep. Sleep is a tremendous immuno booster, and many of our children don't get enough rest. They're up all night cramming. So when you're sleep deprived, your immune system does definitely get whacked. And there's a little bit of literature, and the other doctors can weigh on this, I'm sure. Vitamin D may confer some protective effect. And I go back to what Dr. Najun said. Truth is important. There's been a lot of misinformation out there. Don't give your kids, hydroxychloroquine. Geez, I just read something, doctors, recently, that aspirin can actually potentiate certain cancers. So be careful what you give your children, but there's some natural things we can do. Turmeric, omega-3 fatty acids, vitamin D. I think those are all immunocompetent agents, but most important of all, control stress and make sure they get enough rest. It's so important.
Thank you, Dr. Kelly. I actually started taking vitamin D and C after watching your videos. So thanks for that.
You're welcome.
Ed, back to you. I know cybersecurity is very, it's close to both of our hearts. So question around that. what is being done to ensure a student who receive remote education do not experience cyberbullying now that they're spending an increased amount of time on the internet?
So I think that has to be addressed, not because of COVID, but that should be something that the directors of technology of the various school districts and colleges should be on top of already. There should be policies in place to address that. There should be best practices that are taught to students so that they don't become victims of it. But there should be, they should make it clear in an orientation that, there's severe ramifications for anyone that practices that, especially in a case where they're going to do 95% of their learning online. So there's many more opportunities to have exposure to their peers, and it has to be treated with the right care and respect. There's things you can put in place from a technological standpoint, but social engineering and treating and teaching people to be decent and having that expectation is a whole nother thing. I mean, that's what we expect amongst, from our students in Upper Darby. That's what we demand of our students in Upper Darby. And we have a zero tolerance policy for that. Bullying and cyberbullying are no different. We take that very seriously. And there's ramifications for that, as is all type of assault and bullying and intimidation type measures. All those things are taken very seriously.
Thank you. Last question.
Rabel, I'm so sorry. I
Go
just
ahead.
wanted to
No,
take
sure, please.
this opportunity. What Ed said is, again, this, how like every calamity is really like an opportunity for us to grow and educate our families. I think it's so important for us parents that this may be actually that time where we as parents can speak to our children about cyberbullying, meaning both in times of being a victim or even being a perpetrator of a cyberbullying. So just sit with your child, explain to them what it means, what it entails, why it happens, what are the consequences, and what we can do to stop it. So I think I just wanted to throw in there that this is the time to have that discussion with our children.
No, Dr. Rios, you're very on target with that. And just to add, just based on what you said, that students need to understand that there's no shame, there's no embarrassment in being a victim of it, because a lot of times students will try to keep it a secret because of the stigma attached with being bullied or being victimized online. But we encourage them to speak up so that we can take corrective action. And a victim, you're a victim. It doesn't mean there should be any embarrassment or shame. The shame is in when you keep it quiet or try to hide it when you're the victim. The courage comes in speaking out and defending yourself by telling the proper authorities what's going on.
I'll just encourage everyone that, at CAIR-Philadelphia, we receive these complaints, and feel free to reach out to us. And also, of course, your schools, your districts, the Department of Education has anonymous online lines that you can report this, as our educators have highlighted. Sorry, over to you, Brother Rabi.
No problem. Thank you, Ed and Dr. Najmun and Brother Ahmed, for clarifying that we can have those links available later on, so people can report bullying. Next question is for actually for Dr. Najmun, Dr. Kelly, and Dr. Arshad. Medical professionals are doing their work selflessly, putting themselves at risk, especially with this COVID. And we also have heard about healthcare professional committing suicide. Few cases in New York, I think. Are you concerned about the burnout for medical personnel? What are you doing, and what can other healthcare personnel do to mitigate the mental stress?
Rabbi, if you want me to start.
Sure.
All right. So thanks. I feel like this question is something that, we as mental health professionals have been always worried about. But I have to tell you, when this all began, that was our worst fear as our mental health professional. What we were, because see, we were in the background, right? We were in the backdrop. We stayed home. We did telehealth. We did telepsychiatry. We were not the frontline workers. But it was people like Arshad or Dr. Kelly, who were that on the front line, the nurses, the respiratory therapists, ED physicians, I mean, you name all that staff. And we as mental health professionals were very concerned about their mental health, their burnout. And as a matter of fact, when we used to read in the news about this ER physician, a very famous, exceptionally bright and competent ER doctor who committed suicide, it literally like shook us, and our concerns were triple folded. And I remember speaking with my colleagues that, listen, the COVID may be over, but we're going to get this barrage of PTSD in our own colleagues. But I have to tell you that it is just amazing and so gratifying and relieving to watch how our frontline workers have come out of that phase, whether in New Jersey or New York or Philly, which were the first areas affected. And what they went through was like unbelievable. Being at the front line with not having a proper gear, facing an illness that they had no clue about, had never heard of, didn't know what the treatment is. They were truly and honestly struggling. So being at this in the middle where you are in an authority position, you are a caregiver, you're supposed to reassure your patients, you're supposed to treat them and tell them it's going to be okay. So imagine having that anxiety of not knowing what to do with this patient, and plus the anxiety of what if I contract it? And what if I give it to my family? I mean, just imagine the situation they were in. But they did amazing. I guess a lot of times I feel like, how did they do it? I guess they probably are very resilient human beings to begin with. And also through their training in med school, I mean, they have handled, or they're taught, or they're educated about how to handle stressful situations. So I think that may have a huge role to play in. And with the fact that, just even God Almighty probably gave them a lot of strength at that time to go through this hard phase. And now that we look at them and see that, most of them are doing pretty well, but during that stressful time, we were concerned and watched some of our colleagues pretty much run on adrenaline, have nights where they would not sleep, come home extremely exhausted, again, worried about their own families, about their own health, as well as about their patients. Watching their patients in an ICU setting die is humongously traumatic. Now, remember, all these frontline workers and these physicians, they are human beings. They themselves, some of them, have had past trauma. So we were worried about their trauma surfacing up, which we call like re-traumatizing. And that could have thrown them in an acute state of panic. Their anxiety could have been high. I have seen some of, not a whole lot, but some of my colleagues used to resort to Benadryl and other over-the-counter sedatives to just get that extra hours of sleep, and during the day resort to some caffeine pills. So I, as their colleague and as a mental health professional, was extremely worried. But thank God, it went. The difficult phase is over. And again, being, very thankful to the organizations, to the hospitals, to the individuals, how they handled all of this. They immediately created these support groups, which were existing in pretty much every single hospital, and encourage their workers to come seek help. I remember, I work in an HIV clinic, and I remember reaching out to my colleagues just with direct phone calls, direct texting, and saying, hey, listen, I'm here for you, even if you just want to talk. But creating that support group enormously helped some of the individuals to express and vent what they were going through. So that I felt was tremendously helpful. And now you're mentioning about, so the hard phase is over. So the question, I don't know if Emmett, you mentioned that question, but I saw it in the Google Docs. So the question you were asked is that what can they do from here on? So I guess, again, applauding yourself, patting yourself on the back for what a good job you guys all did. It is time to be aware of your stressors, be mindful of what you guys are going through. And I know, unfortunately, the system in which we live in, I have spoken with a lot of professionals who did not seek help, not because of the stigma, but because of the worry that if they go seek help either through counseling or through a psychiatrist, their employee might find about it. They might lose their job or they may not find another job. It's ironic, it's sad that during this time we have to go through this. I'm just hoping that the leadership will consider that and remove the stigma on the mental illness. In fact, encourage all their employees, their workers to go seek help, provide some free counseling, or even activate their behavioral health department, which a lot of hospitals did do that, and just and have these frontline workers reach out to their own colleagues for whatever help they need. Again, I mean, just to share it with there are a lot of doctors and people on authority positions who sometimes feel that this is a sign of weakness to go seek help. I just want to tell my fellow physicians out there, to go seek help is not a sign of weakness. It is a sign of courage. Do for yourself what you would do to your patients. If you are not hesitant to tell your patient, hey, listen, go talk to a psychiatrist, go talk to a counselor, I would recommend that you do the same for yourself. If confidentiality is extremely important, if you do not want to disclose your identity, there are online counseling services. My two personal favorite are Talkspace and BetterHelp. You can approach these services. Your insurance will not find it out. You can even hide your identity if you want to. In my personal journey, I have utilized some online counseling services, when I went through, death of my father or, whatever it was, but I have never hesitated to do that. And honestly, it is a opportunity for growth. So if any one of you out there is still struggling with some mild to moderate signs of PTSD, or again, re-traumatizing of what you saw in an ICU setting or an ER setting, inability to sleep, ongoing panic attacks, please seek help. So that is the message I would tell my fellow physicians.
You're on mute, Arshad.
Najmun summarized everything so well. And I can tell you, this is actually an opportunity for the school systems to learn from the health systems. We were not prepared for this. This is a once in a life pandemic in 100 years or 200 years. We were thrown into this and we learned and we kind of evolved from this. I think the school systems can learn a lot. I can tell you, healthcare workers had fourfold issues. Number one, they were at work. When Rabiul, when we work in the hospital, we partner with, there's a multidisciplinary team. There's doctors, there's nurses, there's respiratory therapists, there's a pharmacist, and we partner with the patient and the family, and that's how we treat patients well. And this was a situation where there was no contact with the patient and no contact with the family, and the healthcare workers had this moral, this I would say, stress that they could not participate with families, and then patients were dying alone in the hospital on Zoom with the family watching on the other end. The second thing was that these these healthcare workers going home and quarantining themselves, not being able to interact with their families. I did that. I'm still doing that. But the third thing, the stigma. I mean, sometimes the wife tells me, on the way back, can you pick something from grocery? I tell her I will never go there because I'm wearing a scrubs. There is stigma. I think it's real that sometimes even your own family, there have been, episodes where families avoided healthcare workers, the community, they would look down on them. There's a stigma associated with that. And number four, I talk to my colleagues and I see now this stress of kids going back to school. Now, some of our colleagues are, healthcare workers are doing two jobs at the same time to make things meet. And both husband and wife are working. And now the kids could be home the whole time. They could go to hybrid school, but then things could revert. Who knows? There's so much, uncertainty. What if somebody in the school, there's an outbreak and they have to stay home the full time? Who's going to watch the kids? So there's a lot of stress related to that. And I think what Najmun perfectly summarize. And I think for myself, and I tell my colleagues, is be aware of your bandwidth. What can you do? How much can you do? Don't overstress yourself with things that you cannot. Don't overwhelm yourself. And like Najmin mentioned, be careful with the coping strategy. Don't use tobacco, smoking, alcohol, drugs, sleep aids to help you sleep, because that's going to be an issue. And it's just to manage your stress, your psychological well-being. I think these things worked for me, works for everyone. Taking good rest, sleeping well during the night, eating regular healthy food, some physical activity, maintaining contact with your family. I mean, sometimes with text, I did that, sometimes with text, sometimes on, the FaceTime, using the technology that we have to stay in touch. I stay in touch with my friends through Zoom. So those are the things that you got to do. And also, honestly, at the end, to kind of limit time that you're going to watch news, because sometimes when you sit in front of the news, it's become so much polarized, both sides, that you could be listening to COVID the whole time and be so anxious. It's not just you, even kids who are in the home, they could get anxious. So it's just some simple strategies, and then also vitamins, healthy foods and supplements. Those also help.
So, Doc, if you don't mind, I'll just give my viewpoint, whatever it's worth, and then I could just segue with a couple jokes. Is that okay, Rabiul?
Sure. Please go
Yes.
for it.
All right. So just as Dr. Najmun said, it's so important for healthcare workers to name it, to tame it. And, if you have a problem, it's a great sign of courage to get help. And I went through a couple tough times there at residency, and I saw a therapist, and they were wonderfully helpful, and get help. But I think if focus on the fundamentals, this COVID too, when I was quiet in my practice, I got this a chance to recalibrate my life and priorities. And what was that? As the good doctor said, faith. I become more immersed in my faith. My family is everything to me. And I took better care of myself. So now it's funny, like as my practice ramps up, I kind of already missed the old days, where I was only seeing, less patients. But I've lost patients. I've had colleagues on ventilators. As the good Dr. Najmun said, this is a traumatic time for all of us. I definitely had a difficult time sleeping for a while. But when I went back to the fundamentals and immersed
Dr.
myself.
Kelly, sorry to interrupt. We can't see you anymore. Your video is not transmitting.
Oh my gosh, I'm sorry. Well, I'm not as technically privileged as Mr. Brown. Let's see if this works here. But can you hear me though?
We can hear you.
Yeah.
Okay, so I'll just continue with the monologue because we're getting late here. So I just want to tell the audience that I've tried practicing social distancing for my refrigerator. And Dr. Najmun is the kind of psychiatrist I wish I had. She's empathic. She's kind. I see Dr. Rambo, and I told him the other day, I said, I get up in the morning and I look in the mirror and I get depressed. I said, what's wrong with me, Doc? He said, I don't know, but your vision's good. And doctor, I suffer from multiple personality disorder, but my wife says I'm good people. I'm good people. And I do have attention, that's or ADHD, that's called attention deficit. That's a wonderful trophy you have there, doctor, out behind you. Get it?
Oh,
Okay.
that's mine.
Yeah. So the truth is, I'm actually an orthopedic psychiatrist. I'm a bonehead. And I'm half Irish, half Lebanese. And I was told as a kid, Rabiul, that the end of the rainbow was a pot of hummus. So I'll just finish up by just complimenting the other doctors here. Dr. Arshad, I asked him, he's a great pulmonary doctor. I said, what's good for my wind? He said, a kite. And Mr. Brown, I was raised by the nuns. I had Sister Rocky Marciano, first grade, Sister Larry Holmes. And I was raised in a time when time out was when I was out cold. And I used to date a teacher. We had to break up because every time I wrote her a love letter, she kept correcting it. And Tim Kearney has his Hawaiian shirt. Tim, I've never been to Hawaii, but my wife and I won a trip there on a junket. And I got off the plane last year, and this wonderful native put a layer on my shoulder and said, aloha, Hawaii. I said, Kelly, Philadelphia. Anyway, I'll just stop with that. But humor is healing. I made you laugh, which is good. And I just want to close by saying, I want to thank Rabiul, my friend, for putting this together. He's helping people all the time. And I'm honored to be with these really smart people, honestly. As the doctor said, the psychiatrist, kindness rules the day. And don't forget the law of karma. What we put out there, we do unto ourselves, and we're doing to God, we're doing to Allah. So remember, we're all in this together. We wear the masks for others, and a little bit of kindness goes a long way. Stressors are high. We can all be agents of change. We can choose to be a light or a critic. It's our choice. We have free will. Allah gave us free will. So I'd ask you all, let's all be blessings to our family, to our patients, to our loved ones, and all our friends. And I thank you for the opportunity to be on this call with these really smart people. Thank you.
Thank you, Dr. Kelly, for great closing, and thanks for helping me, actually. It was second time. I feel a bit more confident now. With that, I'm going to ask each panelist to say a closing remark, starting with Senator Kearney.
Well, this has really been a half hour longer than we thought, but I learned things here, which is really great. And I love hearing from the doctors' perspectives. In particular, it's not just doctors who are dealing with the same sort of PST things as well. My staff, after getting 900 calls about unemployment compensation stuff, we literally had to do compassion training with them again to try to deal with it and to keep the issue clean and everything else. I'll just say that this is temporary. This is not the new normal. We're going to get through this, and we're going to get through this with kindness and with empathy, and because we all have a lot to lose, and a lot of people have lost a lot of things already, and we need to. It sounds hokey, but we really need to stand up for each other, and we'll get through this.
Thank you, Senator. Ed?
Yep. As usual, Senator Kearney steals my thunder, but I'm the eternal optimist. So I also am optimistic about us coming out of this a stronger, kinder nation, and just having a better understanding of what it takes to be kind to people, and that we all are linked. We all are in this together. And I think we'll come out of this together with with everyone's help. And I think I'm hoping that those lessons of togetherness and cohesiveness and brotherhood will fester and permeate long past COVID being just a blip on the radar and a painful memory. I'm hoping the lessons that we learn from it are what we take from it, and that's long lasting. And the legacy of COVID, I'm hoping that it ends up having a positive legacy from that perspective. Obviously our heart breaks for those that we've lost and for those who've experienced loss as a result of COVID. But I'm hoping that we gain something from it, and that we can just be a better nation overall. So we'll continue to focus on education and paying attention to the science, paying attention to the doctors, and we'll make education decisions based on that. The last thing I want to say is I just want to give my kudos and sincere appreciation to all of the frontline health workers and all of even the health workers such as the ones on this on this part of this panel that even are on the periphery. But I'm humble and I'm grateful, and I admire your courage because you're in harm's way. You put yourself in harm's way for the betterment of all of us to keep us all safe. So I thank you for that. I'm humbled by your courage, and I appreciate your grace and your dignity. Thank you.
Thank you very much, Ed. Dr. Najmun, a closing sentence from you.
Rabbi, I just really thank you, and I so appreciate the fact that we were able to connect with each other. Each one of you, every one of you is making such a huge difference in the society community as general. It has really been a pleasure to be a part of this panel. I do want to end this that we touch bases on kindness, we touch bases on empathy, and we all our faces lit up. I do want to finish it up sharing something about a gratitude. What has helped me and my family with my children's anxiety is going through this COVID. Pretty much every day I would sit with my 10-year-old at bedtime, and we would do a little gratitude prayer. In the gratitude prayer, we would come up with the things that we are grateful for. And one of those things was the fact that we survived another day of COVID, that all our family and our friends were healthy. And we realized that there is so much, in spite of this pandemic, that we are thankful for. And we also paid a tribute to the ones who are not as privileged as us, to the societies who live in poverty, or African American population, Latinos, or low-income people who unfortunately have had multiple losses, who are still under the blanket of grief, and we just prayed for their healing. I think I'm hopeful that we as society can heal from this and emerge stronger and more resilient, and also more kinder, as we said. So thank you.
Thank you, Dr. Najmun. Dr. Arshad.
Rabiul, thank you for this opportunity. This has been great learning from other people and also expressing my ideas and thoughts. But I can say I'm an optimist too, naturally. So I think we did way better than we were expecting. But our thoughts and prayers still go to all the people who lost their lives and their families. We should always remember them in our minds. And I think this pandemic has affected everyone, not just the healthcare workers. There have been so many other people in the back who have been keeping sure that our groceries are running. We're not short on that. We're not short on medications. There are people who have lost their jobs and who have struggled through this. And I think as a community, I think I'm so proud that we live in such a resilient community that really is eventually going to come out of this. And we've been 5 months through this, 6 months through this, and we have stayed together. And I think most of our job is done. We just have to stand the course, and we'll come successful out of it, and we'll learn a lot from this experience. And like Najmun said, it's just kindness, it's empathy and compassion for each other. I think as Americans, we stand strong. I have no doubt that this will be just a story that we'll be telling our next generations and talking about it and saying that how successfully we did this and how we came out of this alive, and also what we learned from this for generations to come.
Thank you, Dr. Arshad. Thank you all. Before we close the call, I would like to ask my co-host, Dr. Ahmed, to say a closing sentence.
No, I thank you, Brother Abiel, again for being the architect behind this program. Thank you to all of you. Thank you to all the platforms who shared this stream with their followers. Again, I want to just repeat what you all said and just remind myself and everyone that our normal that we kind of want to get back to was also had a lot of problems, and this pandemic also showed us clearly that normal was problematic. This was a point that Dr. Rashid Abdul Khabir, one of our board members, had highlighted in one of our earlier programs. So hopefully we all have a renewed dedication to work on those issues to make our society better. And thank you to all of you individually for all the work that you do.
Thank you all. Thank you, Brother Ahmed. I'd just like to remind all of you, this video will be available on CAIR-Philadelphia website as well as MAI. I'd like to thank all the sponsor, all the partner for broadcasting this. This was broadcasted on about 6 or 7 different platforms today. And we talked about kindness. We talked about bullying. As a minority, we have seen the worst, right? I went to school here, and bullying just does not only exist in school, but just about everywhere, whether you go in the doctor's office sometimes. I highly encourage all of you to report it. CAIR has visit CAIR website to report it anonymously. And with that, since we talked about kindness, I'm gonna read off of a quote from Prophet Muhammad and close the call. Kindness is a mark of faith, and whoever is not kind has no faith. Thank you all very much for joining us today and for being patient. Bye.
Thank you.
Bye.
Great job, Ravi.
Thanks, Arkin.
I want Dr. Najmun's address so I can see her as a patient.
Well, I want your address so that maybe I could watch your stand-up comedy, because you cracked up some pretty